Hello again. We left last video on the fact that I got finally diagnosed with pseudotumor cerebri or idiopathic intracranial hypertension. The neurologist had done an LP or lumbar puncture. That was my first one and quite painful. That actually led to a leak, or shall we call it, I was in bed for 10 days with a low pressure headache. A lot of CSF fluid was taken out to avoid headaches, which led to what I found out was called a low pressure headache. I had a very rough time. It was probably rougher because it was all so new to me. I have learned that anything that is new it makes it tougher. When you have experience, especially a lot of experience, things are easier to bear. It was the first time, so the low pressure headaches were very difficult. And I was in bed for about 10 days. I did not require a blood patch, basically because I was very stubborn. I kept telling the doctor, will this pass? And they said, if you lay down long enough, it will. But would you like us to do something about it? And I kept saying, no, you leave me alone. You've done enough harm. They also did give me or start a course of the medication called Diamox. This was to help and prevent any further eye damage, because they had seen on the visual field that my right eye was actually quite affected. I had very little vision on my left eye from birth, but I still had some vision. So they were concerned about both eyes, but mainly my right eye, because that was my good eye, and that had quite a bit of problems. In the next video, I would like to discuss some of the symptoms that I started realizing were part of this condition, and what happened in the next few months, because my vision did decrease. My vision worsened to the point that I ended up needing my first of many surgeries. So this was the period from October of 1992 to February of 93. Thank you.